Hello, this is Dr. Eric Bricker, and thank you for watching AHealthcareZ. Today's topic is consultants and their role in increasing healthcare costs. Now, there was a recent article in the New York Times from November 27th of 2020 about the world's most famous consulting firm, McKinsey, arguably the most elite strategy consulting firm in the world. It turns out that a team of consultants at McKinsey advised Purdue Pharmaceuticals, that's right, the makers of Oxycontin and Oxycodone, of course, that everybody is familiar with. They advised Purdue to pay $14,810 for every overdose or new prescription drug addict that could be attributed to Oxycodone and Oxycontin. And they would pay the $14,810 in the form of a rebate to the distributors of their, in other words, the groups that facilitate the transaction for the payment of the Oxycodone and Oxycontin, i.e. folks like CVS and Anthem and others. Right? So many of you are familiar with the role that rebates play from pharmaceutical companies through the distribution channel, i.e. those folks that are doing the transactions, and then as a result of those rebates, they're trying to basically grease the wheels for more of those prescriptions to be written. Well, Purdue went to the length of saying, hey, look, if somebody gets an overdose or if somebody becomes a new addict, then I think we should specifically pay them over $14,000. Now, in a completely separate example, I know the head of strategy at a major Texas hospital system, and they were considering an accountable care organization. They were considering starting their own health plan. They were doing major investigations into taking on risk themselves, right? Which is, value-based care. And that same hospital system hired a very prestigious consulting firm as well, which said, no, you know what? You just need to push fee-for-service and milk fee-for-service for as long and as hard as you can. So here's an example of basically accomplices, where consultants are acting as accomplices in the increase in healthcare costs for individuals, employers, and for the government. Now, it's really easy to make money in healthcare. All you have to do is exploit people when they're in a position of desperation. Okay, so here you have these bad actors in healthcare. They are not acting alone, and that is my point for today's video. Now, are there many consultants that do many important, wonderful work within healthcare? Of course, but the point is that these consultants can also be enablers of the bad actors who need help to exploit or to carry out, to execute their plans. And there's an entire ecosystem around this. This does not happen by accident. And that's my point for today. Thank you for watching AHealthcareZ.